Hello, my name is Kaylee, and this is my final project for healthcare policy, law, and ethics. I listened to the podcast about a pain management doctor named Dr. Gott. Dr. Gott was a pain management doctor that was doing EKGs and spirometry tests on patients for no reason. He wanted to continue to bill the patients for these procedures that they did not need. During his career, he switched from cardiology to pain management. He prescribed a lot of opioids to these patients to help keep them addicted. He prescribed the opioid methadone so that way they would keep coming back to him since no other doctors in the area prescribed it. Dr. Gott kept having these patients come back for visits to do tests and prescribe the methadone so that way he could make money and they would become addicted. In reality, he was not doing anything to help pinpoint where the pain was coming from, or he would have done MRIs on all of these patients. He just wanted an easy way out to make money and prescribe the drugs. There was one child who overdosed twice on the drugs, and her mother finally decided to put her foot down and tell Dr. Gott that if he did not stop prescribing these drugs to her child, they were going to kill her. This was very eye-opening to some. This ties into our class because we talk about ethics, and this was very unethical and against the law. He was then later sentenced to 8 years in prison for his actions. I do not think that was enough time, and he should have been sentenced longer. I also think that the other providers in the office should have been held accountable as well. It was very wrong what Dr. Gott did, knowing that his actions were causing harm to so many patients. It is also very mind-blowing to me that nobody caught on sooner. He left a lot of people at high risk for addiction and overdose. He is very lucky that he did not kill a bunch of his patients and even other outside people who could have been selling his drug during the time that he was prescribing them. This is very eye-opening and should help others understand how this would tie into our class and how the actions of others can affect you. I think everyone should have to take a class like this at least once before working in healthcare. Overall, this class really taught me a lot of new information about the healthcare world. Being able to understand when something is ethically wrong and how to deal with the situation is something that is very important. Hopefully in the future, I will never have to deal with an unethical situation, but this class really helped me understand the importance of policy, laws, and ethics. Thank you for listening to my video for my final.